Again, good evening. Welcome to our Thursday, March 2nd, 4 p.m. class lecture. I want to go ahead and get started. I have Miss Shayna Joseph that's on the call, on our class call today from Career Services, and she's going to introduce herself and explain what those services provide.
Thank you so much, Miss Crystal. Happy to see you, Jonathan, that's here, and those that will be reviewing on the recording. Just popping in just to see y'all. So Career Services is here. We are available to you all. So any questions you have, career-led questions, nervousness you have, any type of hesitation you're having or anxiety about starting your new career, please feel free to reach out to us. We're here. Thanks, Crystal.
Well, also, Shayna, can you explain? I know we had spoken before about even if they haven't graduated yet and they're seeking employment, that you all can help in that area as well.
Yes, ma'am. Yes, ma'am. We have employers that are interested and are happy to possibly provide career opportunities while our students are in school. So some entry-level positions to get your feet wet, just kind of get your foot in the door, especially those students that are doing career changes. And I know the nervousness of starting something completely new, and maybe you've never been in healthcare before as a career, and you're a little nervous about that. We do have some opportunities while you're in school to maybe get your feet wet, get some healthcare clerical experience underneath your belt for once you finish your program, and maybe a little while after that, then you can maybe move up to some of the other higher pay, higher responsibility and experience needed career opportunities. So, oh yes, if you're in school and you're looking for opportunities, still reach out to us, because we do have employers that are looking and are willing to work with our students.
Thank you so much, Shayna. And for the students who are listening, and once you review this video, if you look in news and announcements and in your e-learning, we have a section that's labeled Career Services with Miss Shayna Joseph and Miss Kelly, who's working on our team for Career Services to be able to assist you. So please just make sure that you're looking in the gray section of e-learning, and they will definitely be able to assist you. I see Miss Samara is logging on. Samara, that's Miss Shayna. You'll be able to review it. That's Miss Shayna Joseph of Career Services, explaining about the different opportunities that they're able to provide. I see you at work.
Make that money, honey. Make that money. You'll see the video. Don't worry about it.
Yes, so you'll be able to review and look at the video of what she explained and what's going on. Thank you so much, Shayna. Appreciate you coming on. Yes, so I'm going to go ahead and get started. I just want to go over some announcements first. Remember that we're coming to the end of the module and the exam. So I'm going to help you all out a little. Instead of doing your Monday exam for chapter 27 and then turning around and doing your final exam on Wednesday, I'm going to combine chapter 27 and your final together, which will be on Wednesday. So you will have extra time to be able to review your information, because remember, your final exam consists of chapter 24 through 27. Chapters 24 through chapters 27 is on your final exam. So again, I'm going to review chapters 24 to 27, but I'm not going to give you that chapter 24 exam on Monday, and then you turn around and have to take that final exam for the module on Wednesday. Remember that module 156 starts on Thursday. Also, remember that, Jonathan, okay, I see you say you did not do chapter 24. That will be deleted, but you still will be responsible, since it was only one module. For the new students will be responsible for that final exam, and I'll just delete those questions from chapter 24 off. So don't worry about it. You won't be penalized for that. So thank you, Jonathan, for that. That's for my new students who started. If you were not in that module at that time, you will not be responsible for that exam. Also remember that the new module that starts, you're going to be doing actual billing and coding. You're going to have a code that you all are going to have to use. It's in the simulation, whereas you will be doing billing. This is your externship. This next module will be your externship. So you will be doing billing, charting, documentation. All of this will be going on because it is your externship module. So please make sure that you're referencing and going back to the information that we had covered. For the newer students, this will be a little difficult for you, but you'll definitely be getting your EHR experience, which is the electronic health record, because you will be in the electronic health record for the next two modules, where you're actually documenting in the client chart, you're pulling information, you're getting billing information, you're finding out if you're actual, what is that patient owed, what is the patient's deductible. So these next two modules are very, very important. So I want you all to take that extra time to pay close attention to your assignments. So remember, read your emails, make sure that you're looking at your PowerPoint slides. Those are very important and will be very helpful for your exams. So I'm going to go ahead and get started with chapter 24. We're doing strictly reviews right now because remember, the exam is chapters 24, chapters 25, chapter 26, and chapter 27. So number one, and remember, you do not have to try and rush and write anything down. This is being recorded, so you will be able to go back and reference this material. So we're going to do a quick review for all of the chapters. So chapter 24. Radiology codes designated as a separate procedure should be reported in addition to the code for the total procedure or service. Is that true or false? Radiology codes designated as a separate procedure should be reported in addition to the code for the total procedure or service. Is that true or false? Samara, you're on. I know, Jonathan, you said you weren't, I know you weren't here for chapter 24, but if you know the answer, you still can reply. Radiology codes designated as a separate procedure should be reported in addition to the code for the total procedure or service. I'm going to share my screen. And I'm going to go to the PowerPoint slides for chapter 24. Get to the PowerPoint slides and then we can review. So a quick little review of radiology, then you might be able to answer that question. The question was, radiology codes designated as a separate procedure should be reported in addition to the code for the total procedure or service. And I asked if that was true or false. So the definition, radiology, branch of medicine that uses radiant energy to diagnose and treat patients. Specialist in radiology is a radiologist, doctor of medicine. The radiology subsections, diagnostic radiology, aorta and arteries, diagnostic ultrasound, radiologic guidance, breast mammography, bone joint studies, radiation oncology, clinical brachytherapy, nuclear medicine. Terms: fluoroscopy views inside of body, projects onto television screen, onto television screen, live images by which physician can view functions and structure of organ. And example 71047776000 checks X-ray with fluoroscopy. So it states radiology codes designated as a separate procedure should be reported in addition to the code for the total procedure of service. That answer is false. That answer is false. So then going back, it has on here, there are 4 subheadings in the radiology section, true or false. There are 4 subheadings in the radiology section. Here are the radiology subsections. So is that true or false? 4 sections in the radiology subsection, true or false? Anybody can answer? And remember, at the bottom, always read your notes under that PowerPoint section. It states right here. Slide 3 indicates the subsections in the radiology section of the CPT manual. Diagnostic radiology subsection contains the most standard radiographic procedures. The diagnostic radiology subsection and diagnostic ultrasound subsections do as their titles say. They assist the physician with the diagnosis process. So always read what they have under that PowerPoint slide. It gives very, very important information. So it says radiology subsections. There are 4 subheadings in the radiology section. Is that true or false?
True.
No. Samara, what did you say it was? Oh, sorry. So the answer is I'm sorry, is false. So it says there are 4 subheadings. Here are the radiology subheadings. There are 4 subheadings in the radiology section. Here are the sections right here. Diagnostic radiology, diagnostic ultrasound, radiologic guidance, breast mammography, bone joint studies, radiation oncology, and nuclear medicine. So it's 1, 2, 3, 4, 5, 6, 7. So there are 7 subheadings in the radiology section. So when you're looking at the text, make sure that you're referencing. That's why I'm showing you where it is in your PowerPoint slides. Majority of the questions that you have on your exam come from your exercises in your book and your PowerPoint slides. So when you're referencing and you're looking at the information for your exams, reference your PowerPoint slides. I mean, your exams are open book. So everything you would need to get a good grade on your exams, everything is there for you. You just have to be willing to read the information. But majority of the answers are in your PowerPoint slides and your exercises, which for your exercises, the answers are in the back of the book. And that's why I constantly say, please do not get the answers just to get the answers. Make sure when you're getting those answers, you're going back to that section or that code so that you have the complete understanding of what you would need to know. So we're going to go on to another one. I'm giving you just a review for each chapter. The next one is a blank procedure is one that is performed independently of and not immediately related to another service. A blank procedure is one that is performed independently of and not immediately related to another service. A, separate, B, multiple, C, closed, or D, conformal. A blank procedure is one that is performed independently of and not immediately related to another service. A, separate, B, multiple, C, closed, or D, conformal. Anybody can answer that?
This in chapter 24.
Yes, chapter 24. And I'm gonna repeat it again. A blank procedure is one that is performed independently of and not immediately related to another service. A, separate. B, multiple. C, closed. Or D, conformal.
All right, I'm gonna take a guess because I didn't do 24 yet because I
Yeah,
missed
it's
out on
fine.
20.
I'm glad you participated, Jonathan. That's great.
I would say A, separately.
Yes, that is correct. Very good. A separate procedure is one that is performed independently of and not immediately related to another service. That is correct. Separate. Next. What is the name of the high frequency sound waves in an imaging process that is used to diagnose patient illness? What is the name of the high frequency sound waves in an imaging process that is used to diagnose patient illness? Is it A, ultrasound, B, radionuclide, C, MRI, or D, radiography? I'm gonna repeat it again. What is the name of the high frequency sound waves in an imaging process that is used to diagnose patient illness? A, ultrasound, B, radionuclide, C, MRI, or D, radiography?
All right,
Anybody want to guess?
I'm
Anybody
gonna
want to
go with
guess?
A. I'm gonna go with A.
A is correct. Ultrasound. That is correct. See, Jonathan, you can take this exam.
Say
Next,
that again.
I said you can take this exam. Next one. So do you have your CPT manual? Jonathan, you have your CPT manual available?
I think it's in my car.
Okay, because you still, well, for this one, you don't need it, but I'm just going over a few. So in clinical brachytherapy, the supervision of radio elements and dose interpretation are performed by the therapeutic blank.
You need the code?
No, not the code. What is it? But that one is, I was just saying, when I was coming up, I was doing a code. But what is this? In clinical brachytherapy, the supervision of radio elements and dose interpretation are performed by the therapeutic who? Who does that? Remember, we're in chapter 24. Who performs the clinical brachytherapy and the supervision of radio elements and dose interpretation are performed by the therapeutic who?
The radiologist.
Radiologist. Very good. Next, we have I need a code. Samara, I know you're at work. Are you able to use your book, or you're not able to today? Probably can't answer right now. So this is a code. Cerebrospinal fluid leakage detection and localization. Cerebrospinal fluid leakage detection and localization. I need the code for that. Cerebrospinal fluid leakage detection and localization. What is the code for that?
Say that one more time.
Cerebral spinal fluid leakage, detection and localization. Cerebral spinal fluid leakage, detection and localization. What is the CPT code? Cerebral spinal fluid leakage, detection and localization. I need the CPT code. Any idea? Anything close to it? You didn't find anything yet, Jonathan?
G9601.
No, not a G. Cerebral spinal fluid leakage, detection and localization. So what range should you be in? If you're in the radiology section, you should be in the 7s. Should be in the 7s.
You say cerebral leakage fluid?
So yeah, cerebral spinal fluid leakage, detection and localization. And you should be in a 7 section, radiology. We're in the radiology section. So you should be in 7s. Cerebral spinal fluid leakage, detection and localization.
$97.01.
Remember, you should be in the 7s. So I'm gonna go ahead and give that so you'll be able to reference it in your book. The answer for that is 78650. 78650.
Okay.
So you'll be able to look that up. So on here on this PowerPoint slide, it talks about terminology. Radiology uses a wide variety of terms and abbreviations specific to planes, positions, and projections. Under the slide, it states many terms are used in the radiology section to describe planes, position, and projections. What do some of these terms refer to? Proximal, distal, lateral, dorsal, supine, ventral, prone, decubitus, oblique views, tangential protection, axial projections. So on here, it says component coding. So the 3 component coding terms is professional, technical, and global. The professional component, the technical component, and the global component. This is on your exam. There are 3 component terms: professional, technical, and global. It's considered component coding. This is on your exam. So please make sure that you review this video and reference your PowerPoint slides. Professional component, modifier 26. Professional component is the physician portion of services. It includes supervision of technician, interpretation of results, including written report. We went over there in a previous question when I asked, and it was a radiologist, which is a professional component, modifier 26. Physician portion of service includes supervision of the technician, interpretation of results, including written report. That professional person is going to review the interpretation results and the written report. Under here, I can't stress enough to make sure you read under the PowerPoint. The professional component describes the services of the physician, including supervision of taking of the X-ray film and interpretation of the X-ray films with report. Modifier 26, if only the professional component is being coded. If only this professional component is being coded and nothing else, you're going to use modifier 26. Technical component, TC, technology services. This is for equipment, film, and supplies. You're going to use the technical component modifier, TC. The technical component describes the services of the technologists and the use of equipment, film, and other supplies. Modifier TC is appended if only the technical portion is being coded. So remember, you have the professional, technical, global procedure. Both professional and technical portions of radiology service. If facility where procedures was performed owns the equipment and has a radiologist on staff who reads the report, this is a global service. You do not need no modifier TC, no modifier 26. TC is technical component, and then no modifier professional component. You would use the global procedure, both professional and technical portions of radiology service. Again, it states, a global procedure includes both the professional and technical components of the service. No modifier is required. That can be one of your true false. Make sure you're highlighting this in your PowerPoint slides. It says, give an example of a global service. Here is an example. A patient goes to a clinic and has a CT scan of the thorax without contrast, which is 71250. The clinic owns the CT scanner, the technical portion, and the radiology on staff interprets the results. Professional component. Here you would build globally 71250 with no modifiers. So make sure that you're referencing these examples that they're providing. This will be on your final exam. Component modifiers. If only professional component of radiology services provided, append modifier 26 to code. If only technical component provided, append modifier TC to code. Modifier TC is a HCPCS modifier used with CPT and HCPCS codes. So now we're going to move on to chapter 25. True, false. And a lot of you all do well, but when it comes to the true, false, you all get confused. And they will have true, false on your national certification exam. So you definitely have to know this information. Services in pathology laboratory are provided by a physician or a technologist under responsible supervision of a physician. This is true or false. Services in pathology laboratory are provided by a physician or by technologists under responsible supervision of a physician. Is this true or false?
True.
This is true. It has to be under the supervision of a physician. So in the beginning, types of pathology and laboratory, subsections such as, this is all in pathology and laboratory, subsections such as organ or disease-oriented panels, drug assay, therapeutic drug assays, evocative suppression testing, consultation, clinical pathology, urinalysis, molecular pathology, chemistry, hematology and coagulation, immunology, transfusion medicine, microbiology, anatomic pathology, cytopathology, cytogenic studies, surgical pathology, transcutaneous procedures, other procedures, reproductive medicine procedures. All of these subcategories, subsections are in the pathology and laboratory section. Next question. A service that is rarely provided, unusual, variable, or new may require a special report in determining medical appropriateness of the service. A service that is rarely provided, unusual, variable, or new may require a special service, a special report in determining medical appropriateness of the service. True or false?
True.
That is true. Next one. The postmortem codes 88000 through 88099 represent physician services only. The postmortem codes 88000 through 88099 represent physician services only. This is in your chapter 25.
False.
No, this one is true. So if you look in codes 88000 through 88099, this represents physician services only. The answer is true. On your PowerPoint slide, this is on your exam as well, pathology and laboratory are codes for laboratory tests only, specimen collection coded separately. Example, venous blood draw reported. That's this in the surgery section. Medicare fee schedule each year identify those lab tests associated with a physician component. Modifier 26. Facility indicators allow additional tests without physician written order. Example, urinalysis positive for bacteria, built-in indicator for culture. So facility indicators allow additional tests to be performed without physician written orders. It says here, laboratories have built-in indicators that allow additional tests to be performed without a written order from the physician. These standards are set by the medical facility. So this doesn't happen at every facility. Indicators imply that if a test is found positive, it is assumed that the physician wants more information on the condition. If a routine urinalysis is performed, a culture is performed if the test is positive for a bacteria. Pathology laboratory caution usually reports second or subsequent tests with modifier 51. Multiple procedures rather report times. So that means that instead of doing all of that, you're going to put like ×3, ×4. The only CPT modifier used in this section are 90 and 91. So you know that's a test question. In the pathology and laboratory section, the only CPT modifiers used in this section for pathology laboratory caution, remember, pathology laboratory caution are modifiers 90 and 91. Again, in the front of your CPT manual, you have all of your modifiers in that front cover. if you have your CPT manual, the front cover has your symbols, all of your modifiers, category 2 modifiers, anesthesia physical status modifiers, modifiers approved for hospital outpatient use, your level 1 CPT, level 2 HCPCS National, everything that you would need as far as your modifiers is in the front cover. When you open your book, in that cover, you have all of that information provided for you. Next question. How many levels of surgical pathology are there? How many levels of surgical pathology are there? A, 2, B, 3, C, 5, or D, 6? How many levels of surgical pathology are there? A, 2, B, 3, C, 5, or D, 6?
6.
Yes, the answer is D, 6. What types of drug tests measures the amount of a drug in the specimen? And I remember this like this was yesterday. We went over all of this on your previous chapter 25 review for your exam. What types of drug tests measures the amount of a drug in the specimen? A, quantitative, B, qualitative, C, confirmatory, or D, immunoassay? Repeat it again. What type of drug test measures the amount of a drug in the specimen? A, quantitative, B, qualitative, C, confirmatory, or D, immunoassay?
It's B, but I don't know how to spell it the right way because it's the long quantitative. Because I remember it's on the thing that we had, so it should be B.
But it's not qualitative. It's A.
It's A then.
Yes,
right.
Quantitative. Yes.
Yeah.
So to help those who are watching and when they review it, go back and reference your exams. Everything that's going to be on this final is from your previous exams that you have taken. And then remember on here, look at these PowerPoint slides, rules of panels. All tests must have been conducted and be medically necessary. Do not use modifier 52, reduced service. Additional tests over those in panel reported separately. If all tests in panel not performed, list each test separately. Do not use panel code, problem-oriented in scope. So it's giving you and it's telling you everything you would need to know. Presumptive drug class screenings, 80305 through 80307, very short little span, 305 to 307. Divided by methods. This is important to know when you're coding. 3 different method categories include optical observation, 80305, instrument assisted, 80306, instrument chemical analyzers, 80307, identifies presence or absence of drug. Underneath your PowerPoint slide, drug screening is an analysis which identifies the presence or absence of a drug. Code this carefully. Understand that you can code the number of procedures performed, not the number of drugs being tested for. Very important to know. I'm gonna repeat that again. Code this carefully. Understand that you can code the number of procedures performed, not the number of drugs being tested for. Which code is reported if screening is performed visually? And it tells you here, 80305. So if it's performed visually, optical, which means visual, by sight, 80305. If it was instrument assisted, 80306. If it was instrument chemical analyzer, they had to add a chemical to the urinalysis, 80307. Presumptive drug class screening, 80305, still ranged to 80307. It says the thin layer chromography drug screen is presumptive for single or multiple drug class method per date of service and reported with 80307. Next question. In what section would you locate codes to report vena punctures and arterial punctures? In what section would you report codes from vena puncture and arterial punctures? A, surgery, B, EM, which stands for evaluation and management coding, C, medicine, or D, pathology and laboratory. In what section would you locate codes to report vena punctures and arterial punctures? A, surgery, B, EM, which stands for evaluation and management, C, medicine, or D, pathology laboratory.
Medicine.
Excuse me, not medicine. Key term, vena punctures and arterial punctures.
What's the four things?
It says, in what section would you locate codes to report vena punctures and arterial punctures? A, surgery, B, EM, C, medicine, or D, pathology laboratory.
Pathology laboratory.
No, it would be A. See, that's that trick one, because they tell you vena punctures and arterial punctures are in the surgery section. Yes, that's located. That's where the little trick comes in. It's in the surgery section. Next one, before we move on to chapter 26. In the pathology laboratory section of the CPT, drugs are listed by their blank names. In the pathology laboratory section of the CPT, drugs are listed by their blank names. A, brand, B, manufacturers, C, chemical, or D, generic. In the pathology laboratory section of the CPT.
Brand.
Not brand. In the pathology laboratory section of the CPT, drugs are listed by their blank names: brand, manufacturers, chemical, or generic.
Generic.
Yes, they're listed by their generic name. Next, moving on to chapter 26. Chapter 26, the medicine section. So the medicine section is diagnostic and therapeutic procedures. Most procedures are non-invasive, which means not entering the body, contains invasive procedures. Example, 92973, percutaneous transluminal coronary thrombectomy. numerous notes throughout. So in this section, in the medicine section, it's very important that you read all of the notes that's listed next to that code. You have to read all of the notes before your code. It states at the bottom, the medicine section includes codes, look at this large range, 90281 through 99607. And is used for coding diagnostic and therapeutic services that are generally non-invasive. Some invasive procedures such as cardiac catheterization and percutaneous thrombectomy are included in this section. The various subsections contain many specific notes to be used with certain groups of codes. These notes are important for coders to read so they can code services appropriately. Subsection. So in the medicine section, there's a wide variety of services, many specialized tests. Examples: audiology, biofeedback, immunizations, often used. Two types of immunizations are active and passive. Correct coding includes supply injected, administration of injection. Active immunization is given when it's anticipated that the person will be in contact with disease. This is on your exam. Active immunizations is given when it is anticipated that the person will be in contact with the disease. Passive immunization does not cause an immune response. What happens instead, injected material, example, immune globulins, contains a high level of antibody against a disease. So remember, there are two types of immunization. Again, this is on your exam, active and passive. Active, bacteria or viruses. Bacteria that causes disease made non-toxic, toxoid. Active is bacteria that causes disease made non-toxic, toxoid. Injected to build immunity. Remember, the active is injected to build immunity. Small dose active virus injected, which is a vaccine, injected to build immunity. Example, poliovirus. Examples are here. Active immunizations can be toxoids or vaccines. Toxoids are bacteria that have been made non-toxic. Vaccines are viruses that are given in small doses and cause an immune response. Passive immunizations does not cause immune response. So make sure you know the difference. Passive immunizations does not cause immune response. Contains antibodies against certain diseases, immune globulins. Name a disease for which passive immunization is used. Here are your examples. Name a disease for which passive immunizations is used. Rabies, hepatitis B, or tetanus. So when they have those questions, when we're given, you know, it's showing for a lot of you all that you're not reading your PowerPoint slides and reading the information under your PowerPoint slides. It's given examples here. For a passive immunization, some examples are rabies, hepatitis B, or tetanus. Immune globulins, it's telling you that code range. Identifies immune globulin product. Example, botulism, antitoxin. Report administration separately. It says the immune globulin subsection is relatively new to the CPT manual. So this is something new that is going on that they have added to the CPT manual. That will be in your add-on code. So you have to pay attention. This is relatively new to the CPT manual. The codes in this subsection report only the immune globulin, which is the product and must be reported in addition to the appropriate administration code from the appropriate subsection. Immune globulins, this is the category range, codes divided by type. Example, rabies, hepatitis B. Method, example, intramuscular, intravenous, or subcutaneous. Dose, full dose or mini dose. Codes in this subsection are divided by type of immune globulin, method of injection, and type of dose. Immunization administration for vaccine toxoids. This is the code range. Administration, performing the injection of substance, reported with substance given. So the next question for chapter 26, medicine section. Psychiatric diagnostic interview examination includes psychiatric diagnostic interview examination includes A, history, B, mental status, C, disposition and communication with family or other sources, or D, all are correct. Psychiatric diagnostic interview examination includes A, history, B, mental status, C, disposition and communication with family or other sources, or D, all are correct.
All above.
Right, that's true, D. So we're only going to go over a few because this test is still open for you all. That's due by Sunday. So we're going to move, and I think some of you have taken it already. We're going to move on to chapter 27, which you're in right now. This is just a review, but I don't want to give you all the answers because all of the answers are in your PowerPoint slides and your exercises. So chapter 27, this is what you all are doing now, inpatient coding. Selection of inpatient principal diagnosis, condition established after study, which is the test, chiefly responsible for patient admission, applies to all non-outpatient settings, acute care, short-term, long-term, and psychiatric hospitals, home health agencies, rehab facilities, nursing homes, etc. So right here at the bottom, it says, what is the difference between the primary and principal diagnosis codes? Principal diagnosis sequence first in inpatient coding. In an outpatient setting, indicate as the primary diagnosis the main reason for the visit and sequence the primary diagnosis first. The principal diagnosis is determined by the circumstances of the patient admission. This is on your exam. The principal diagnosis is determined by the circumstances of the patient admission. The coder should list the code for the diagnosis, condition, or problem shown in the medical record to be chiefly responsible for the services provided. The coder should list the code of the diagnosis, condition, or problem shown in the medical record to be chiefly responsible for the services provided. Then the coder should list additional codes that describe any coexisting conditions that affect the care of the patient for the encounter. Selection of inpatient principal procedure. This is on your exam. Selection of inpatient principal procedure. Code from ICD-10 PCS Principal procedure is definitive treatment rather than diagnostic or exploratory. Necessary to take care of a complication. If two procedures meet criteria, report one most closely related to the principal diagnosis. Selection of inpatient principal procedures. Code from ICD-10 PCS. Principal procedure is definitive treatment rather than diagnostic or exploratory. Necessary to take care of a complication. If two procedures meet criteria, report one most closely related to principal diagnosis. The second part, procedure is significant if it is surgical in nature, carries a procedural risk, carries an anesthetic risk, requires specialized training. So number one, here's the first things, selection of inpatient principal procedures. And the second part, procedure is significant if it is surgical in nature, carries a procedural risk, carries an anesthetic risk, requires specialized training. Diagnosis and services. Diagnosis and procedure must correlate. The diagnosis that you're going to use and the procedure must correlate. Medical necessity must be established through documentation. Key thing here, if it does not correlate, it's no reimbursement. And then you'll have a problem if you cannot be paid for what has been delivered. Diagnosis and procedure must correlate. Medical necessity must be established through documentation. No correlation equals no reimbursement. So the next question, and we'll be closing out in a few minutes. The principal diagnosis is defined as the most serious condition during a patient's hospital stay. The principal diagnosis is defined as the most serious condition during a patient's hospital stay. True or false?
True.
No, that's not true. That is false. Remember, we just went through right here. Selection of, let me go back to the next. Selection of inpatient principal procedures. Code from the ICD-10 PCS. Principal procedure is definitive treatment rather than diagnostic or exploratory. Necessary to take care of a complication. If two procedures meet criteria, report one most closely related to principal diagnosis. Procedure is significant if it is surgical in nature, carries a procedural risk, carries an anesthetic risk, requires specialized training. So the principal diagnosis is not determined by the most serious condition. It's determined basically if it's surgical in nature, carries a procedural risk, carries an anesthetic risk, requires specialized training. Last one before we close out. Which is on the exam. A significant procedure is one that A, carries its anesthetic risk, B, is surgical in nature, C, requires specialized training, and D, all are correct.
All are correct.
Right. So the reason I did that is because I want everyone, when they actually look at this video, and if they're not looking at their class lecture, you're really, really missing a lot, because this is what I wanted. I like to show you that when you're taking your exams, majority of everything we have covered, it's in the PowerPoint slides. And the PowerPoint slides breaks down the information that's in your textbook so that you can easily understand what's going on. And it tells you, it just gives you everything, because online it's an open book. You have all of the resources. You have your CPT manual. You have the answers in the back of the book, which I state, don't just use that, use it to your advantage, but then go look for that actual answer if you don't understand how to get that code. Get the answer, go in your CPT manual, look at the main terms that were used to find that answer. So it's just very important that you see that the information that I'm pulling that's on your exam, it's in your PowerPoint slides, it's in the chapters, in your exercises, in your workbook. I am not making up anything to put on the exam. All of the information that's on the exam is information that's being covered, but you do with billing and coding, you have to read. You have to constantly read, and read. When you're reading that chart, you have to pull out that important information to be able to get that business, that company, that doctor's office reimbursed. If that doctor is not being reimbursed, that clinic or practice is not being reimbursed and getting the money in, then you won't have a job. So make sure you're paying attention in class. Make sure if you're not understanding any of the information, give me a call. We can do a one-on-one session. I keep explaining this, but I only have a few students who are actually taking that as an advantage and calling, and we're doing one-on-one sessions so that we can do a couple of scenarios on coding so that you can find those main terms, that you can go back, because the next module we go in, you're actually going to be billing and coding. You're going to be doing electronic health record charts. You're going to be putting information. You're going to be setting appointments. This is going to be your clinical, your externship that you will be doing online, but you're doing sim charting. It's in the sim chart format, but you will be doing all of these things. So please pay attention. Look at these videos. Join us on our NCCT certification class that we have every Tuesday for 2 p.m. The information that we're providing is in your e-learning. We have provided you with the packets, the questions, and the answers that's going to be on your national certification exam. So even if you have to take 10 a day in review and just keep going back and reviewing all of those different sections, it's going to be very helpful. Joining in on Tuesdays for 2 p.m. if you're able. And if you're not able, going back and watch those videos, it's still going to help you understand and how to find those codes, what information is going to be on that certification exam when it's time for you to take that exam. So remember, reach out to me, email me, give me a call, text, whatever you would need to do, and I will be able to assist you. Jonathan, I'm about to stop recording, and then I want to speak with you for a minute. Thank you so much, everyone. And enjoy your weekend. Stay safe. If you have any questions or concerns, please reach out to me. Enjoy the rest of your day. Bye-bye.